Thanks for staying with us at STL Live. I'm Jade, Harrell. My guest is President and CEO of the Deaconess Foundation, Reverend Dr. Starsky Wilson. We were talking about the incredible rise to the occasion of many folks to create the fund to RIP medical debt here in our area. How did you land on who receives the funds, and then what's the impact?
Yeah, I think one of the kind of great marks of the generosity of the people who gave to this effort is that they didn't know who they were giving to. What we knew, we worked with RIP to say, we want to target the highest poverty zip codes in our community. We want to absolve the debt of people who live at or below the poverty line. And they, because they were able to purchase in bulk, they just got it by household and address. That was totally anonymous to us. But when we got the list back, we did get a list back to say how many households per zip code, to see what is the amount of debt in each zip code. And what we saw finally was that over $12.9 million just in our region in 80 zip codes was absolved and abolished from people who are our neighbors every day, who are wrestling with the realities of the same kind of day-to-day experiences that we're having here in the St. Louis region.
You talked about those national numbers. What's the impact of relieving that debt on a family or broadly our area?
Yeah, I mean, so we think about this nationally. So there are right now 43 million Americans are wrestling with $75 billion worth of past due medical bills, right? So when we start to talk about that, that's the St. Louis region over 10 times over across the country. Every citizen who's wrestling with this. Healthcare spending is about 18% of national spending on the state and national level from a government standpoint. This is a significant part of our economy, and regionally, healthcare is significant. 5 out of 10 of our largest employers are healthcare or health system related.
Right here,
just right here in our area.
Have they partnered with you on this as well to maybe, I'm sure you had to go to them to pay off the debts, but have they kind of stepped in to help narrow this gap of what's owed? And
on this partnership, so there are a couple of things that happen. Number one, they write off a lot of charity care. So when we talk about the impact, let's say there were 11,000 people who needed this, whose debts had already gone to collections and were on their way to bankruptcy. And there were people that the hospitals wiped out for charity care even before it went this far.
Oh, wow.
So when we talk about the number of people who have this kind of need, it's even larger than what was impacted here. Where we've seen hospitals step up is this point that I'd like to make. We wouldn't have to do this had we expanded Medicaid like most other states in the United States have done. All but 13 states have expanded Medicaid, or they're doing so this year. Where the hospitals have stepped up is to say, this is good business for us. The hospital associations, including on the day that we made this announcement, the president of Christian Hospital standing with us to say, yes, this is crippling people in our community. It is causing people to have a drag on their economic mobility. We need to expand Medicaid. And right now in Missouri, we have an opportunity to sign petitions to do that, to put it on the November ballot, and do it among the people so that we can relieve folks of this kind of burden. Charity is not going to resolve it for us. We actually have to change public policy.
Charity is responsive, but expanding the help and preventative type measures can do a lot more on the front end.
Absolutely.
Where do you need our help?
We really do need people to work with our partners in the community. So Deaconess is blessed to be able to partner, to fund, and to advocate with people like Missouri Jobs with Justice, Action St. Louis, Metropolitan Congregations United, who are all right now out collecting signatures to help to expand Medicaid in our community. So we'd love for folks to contact us, for us to get you in contact with these remarkable partners, to get you to sign a petition, to sign up and reach out to neighbors, to make sure that we can expand God's healing touch to all the citizens here in the state of Missouri.
Fantastic. We want to be sure that you get connected. So know that the Deaconess Foundation is a faith-based grant-making organization supporting those in the St. Louis area. Join in the effort. The foundation has recently paid off the medical debt for many in St. Louis and giving the residents there a little ease. For more information about its latest act or about the foundation and how you can get involved, visit deaconess.org or call them at 314-436-8001. There's more STL Live after this, so stay tuned.